Did you forego your morning coffee today simply because you were getting a blood test done? Or perhaps you skipped drinking water altogether, assuming it was the right thing to do? Well, as a brain doctor, I have a shocking and somewhat worrisome truth to reveal to you. A few minor foot slips before a standard blood test, particularly after the age of 60, can silently elevate your blood pressure, congest your blood, and in the worst possible situations, cause a stroke. Yes, I know. It's just a blood test. No big deal, right? But here's the part most doctors don't speak about freely. For older adults, whose blood vessels may already be more fragile and whose nervous systems are a bit slower. To respond, getting your pre-test routine wrong isn't just uncomfortable. It can be downright dangerous. Here's the shocking reality. Most people over 60 unknowingly make at least 3 of the 10 critical mistakes I'm about to reveal. Not once, not occasionally, but every single time they get blood work done. That's why you have to watch this video to the very end. Because the true danger? It doesn't begin with the needle. It begins with what you do when the nurse hasn't even entered the room yet. Stay with me, and I'll teach you precisely how to safeguard your brain, your heart, and possibly even your life. Beginning with your next blood test. Have you ever felt dizzy, weak, or just off after a blood draw? Type 1 in the comments if so, or 0 if not. And don't forget to hit that subscribe button for more life-saving hacks from Daily Health. Mistake number 1, forgetting water. Let's start with a typical mistake that does no harm, yet quietly puts your health in jeopardy. Not having water before a blood draw. Most people interpret fasting as that you can't eat or drink anything, so they starve not only of food, but water as well. Big oops. Particularly if you're older than 60, even mild dehydration makes your blood thicker. That is, it flows more slowly in your body. Your heart has to work harder to circulate it, and that added work can shoot your blood pressure at the last minute, before the test. But here's where it gets really scary. Thick blood also has difficulty getting to your brain. That's when dizziness begins. Dizziness and, on occasion, a mini-stroke known as a TIA, transient ischemic attack, that strikes suddenly, usually in the elderly with already delicate blood vessels. And indeed, a 2022 Journal of Vascular Health study discovered that elderly individuals who fasted without adequate hydration were about twice as likely to have sudden blood pressure fluctuations during routine morning exams. You know those fainting episodes some individuals experience following a blood test? It's not usually the needle. It's dehydration. Tip number 1, what to do instead. Well, here's an easy solution. Drink a glass of water 1 to 2 hours prior to your appointment. 8 ounces or so. Not too little, not too much. It will get your blood to flow better, keep your brain safe, and provide you with better test results. Now that we've discussed what you consumed, it's time to discuss what you were eating last night, because that salty meal that you hardly gave a thought about, it could lead you into a perilous morning. Mistake 2. Late-night salty foods. What did you eat for dinner last night? Perhaps it was a steaming hot can of soup, some instant noodles, or a quick dinner takeout. It didn't seem like a big deal. Just one meal, right? The blood test is tomorrow morning, but this is what really happens behind the scenes. Late evening high-sodium foods have the potential to increase your blood pressure overnight. And because blood pressure tends to rise naturally, in the early morning, that salty dinner acts like gasoline on a fire. Now here's where age comes into play. As we age, our arteries stiffen. They don't stretch and recoil the way they once did. So when blood pressure rises, those stiffed-up arteries can't take the pressure, placing direct pressure on your brain's sensitive blood vessels. According to the American Journal of Hypertension, late-night salty meals can raise the risk of early morning strokes in older adults by up to 35%. And remember, you haven't even had your blood drawn yet. And it gets worse. If you're also dehydrated from fasting, the salt draws even more water out of your cells, further thickening your blood and throwing off your electrolyte balance. Tip 2. What to do instead. Here's your action plan. The evening before your test, take it easy on the salt. Steer clear of canned, packaged, or processed food. Pass on the chips, soy sauce, deli meats, anything with lots of salt. Stick to a light home-cooked meal with little seasoning. Your brain and your heart will appreciate it. Preview next mistake. And while we're on the subject of test preparation, there's one more mistake that can be equally dangerous, particularly if you're on heart medications. Mistake number 3. Skipping medication without consultation. On to another dangerous assumption, one that can boomerang big time. You've had a morning blood test and you're thinking, do I take my regular meds or do I skip them? So perhaps you skip your blood pressure medication. Or miss your blood thinner this once. Hold it right there. Unless you were instructed by your doctor to miss a dose, never think it's okay to just skip your medicine, particularly those for your blood pressure or heart. Here's why. Missing one dose will stimulate what's referred to as the rebound effect. Your blood pressure could surge on you unexpectedly, or your blood could become more susceptible to clotting. And for seniors, that's a bad combination. A study from the Cleveland Clinic found that patients over 60 who paused their antihypertensive meds without medical guidance had a 42% higher risk of experiencing dangerous blood pressure spikes, sometimes leading to emergency care just hours later, and it's not just blood pressure meds. Skipping blood thinners increases the risk of stroke from sudden clot formation, especially if you're already fasting, dehydrated, or under stress. Now I understand, some people are concerned that medications could affect test results. But here's the truth. If a medication can impact your lab results, your physician will let you know exactly what to do. Guesswork can be fatal. So prior to your next test, take a few seconds to ask, should I take my AM meds prior to this blood draw? That brief 5-minute discussion could potentially save your life. Now let's discuss another good-intentioned error. Most people believe they are doing something good for themselves, when in reality, they're jeopardizing their brain and body. Mistake 4. Fasting too long. Fasting prior to a blood test is necessary. But here's the catch. Many individuals fast for longer than they need to. They reason, if 8 hours is okay, then 14 must be better. And they don't eat after lunch, they miss dinner, they skip breakfast, and arrive at the lab running on fumes. Here's what really happens. If you fast for more than 12 hours without adequate hydration, your blood sugar goes too low, and it's not just about being a little bit hungry. Low blood sugar impacts your brain, your balance, and your blood pressure. You may feel dizzy, confused, or even faint before the test even starts. In a 2020 Johns Hopkins study, researchers monitored patients aged over 65 who had fasted for over 13 hours prior to routine tests. Close to 1 in 5 experienced symptoms such as blurry vision, dizziness, and in some, brief loss of consciousness. And these weren't critically ill patients. These were average older people trying to do the right thing. Here's the improved method. Unless your physician tells you otherwise, try for a 10 to 12-hour fast, not longer. If you have your test at 8 a.m., have a light dinner between 7-8 p.m. the evening before. That should be plenty of time to get you a good reading without jeopardizing your health. And yes, don't forget that glass of water in the morning. Next up, let's discuss a popular morning habit that feels soothing, but may be putting your heart in overdrive before your test has even started. Mistake number 5, morning coffee before your test. For decades, it's been morning routine for millions, particularly before an important day like a doctor's appointment. Coffee wakes you up. It gives you concentration. It feels like a hug in a mug. But here's the sneak attack. Caffeine doesn't simply wake up your brain, it wakes up your heart. and sometimes it pushes it too hard. When you have a blood test, drinking coffee beforehand can increase your heart rate and send your blood pressure soaring, especially if you're older than 60. That means your test results might not be your real numbers, and worse, your heart and blood vessels may be working too hard unnecessarily. A 2021 clinical study in hypertension research discovered that elderly people who consumed coffee within 2 hours of a blood test reading averaged a 12-point higher systolic measurement. That's enough to mislead your doctor, or worse, cover up an underlying heart condition. But the problem isn't merely numerical. Caffeine can make you jittery, nervous, or dizzy just before the blood draw. And if you've fasted, that coffee comes on even stronger, resulting in a blood sugar crash or even a racing heart on an empty stomach. And while we're talking about mornings, ask yourself this. Do you fit in a workout before rushing off to the lab? You may be surprised at how exercise prior to a blood test might scramble your results and your safety. We're going to lay that out for you next. Mistake number 6, exercising before your blood test, so you're dedicated to staying healthy. Perhaps you're one of those people who wakes up with a little movement, a fast walk, resistance bands, or maybe even some gardening. That's great, most of the time. But if you're going for a blood test, your morning exercise may be harming you more than helping. Here's why. Exercise naturally increases your heart rate and blood pressure. That's completely normal. But if you're over 60, your cardiovascular system is already working a bit harder to maintain stability. This temporary spike can skew your lab results, or, worse, overwork your heart when it's already under stress. A 2020 study by the American Geriatric Society followed seniors who exercised within 2 hours before their blood test. The results? Significant fluctuations in blood pressure, heart rate, and stress hormone levels, enough to distort critical test readings. Even more concerning, some participants reported dizziness and mild chest discomfort, not from the needle, but because their body hadn't recovered from the workout in time. If you're also fasting and dehydrated, exercise may temporarily reduce blood flow to the brain, increasing your risk of lightheadedness, or even a TIA, transient ischemic attack. What's the solution? Keep it light. Avoid cardio, weights, or even fast-paced walking before your test. Rather, do some light stretching or deep breathing. Save the actual workout for after your blood draw. Now, let's move on to something you likely haven't thought a lot about: what you wear to your blood test. Yes, your outfit may be influencing your results and your safety. Mistake number 7, wearing tight clothing to your appointment. It's natural. We want to look decent for a medical appointment, so we tug on tight sleeves, tight compression tops, or belts that fit just a bit too tightly around the waist. But here's something most folks don't know. Tight clothes, particularly around your arms or stomach, can impede circulation. And for people over age 60, that can be a problem. Impeded blood flow makes it more difficult for the nurse to locate a vein. That may result in longer with the needle, repeated tries, and more pain. Even once the blood is taken, poor circulation can cause numbness, dizziness, or fainting to linger, particularly when combined with fasting or mild dehydration. Indeed, a clinical nursing research study discovered that older adults who were wearing tight sleeves or waistbands when they went to the lab were considerably more likely to experience dizziness after the blood draw. What should you wear instead? Stick with something loose and airy. Choose a short-sleeved or one that rolls up easily. Leave belts and waistbands loose. You'll feel better, minimize complications, and recover faster. The last mistake: sleeping badly. Finally, let's discuss one of the most common but potent errors you can commit prior to a blood test, one that impacts your brain, heart, and blood vessels simultaneously. Poor sleep. Mistake 8. Not enough sleep before your test. Sleep isn't always easy, and losing just A few hours of sleep the night before your blood test can have dire effects, whatever the reason: stress, restlessness, or a rowdy living situation. Poor sleep doesn't make you just feel wiped out the next morning. It places additional stress on your heart and brain. When you don't get plenty of rest, your sympathetic nervous system, the one that triggers your fight or flight response, gets revved up too early. This makes your blood pressure go up, your blood vessels constrict, and your heart pump faster. Not really what you need approaching a clinic. A 2021 research published in the Journal of Sleep Research found that adults aged 60 and older who slept fewer than 5 hours before a test were much more likely to have increased chances of vascular spasms during and following blood draws. Even if you are not sleepy, your body is already stressed. Throw fasting, dehydration, and test anxiety into the mix, and the risk of dizziness, abnormal heart rhythm, or mini-stroke, TIA, is huge. Here's what to do instead. The night before your test, wind down early. Turn off screens at least an hour before bed. Keep your bedroom cool, dark, and quiet. Aim for 7 to 8 hours of uninterrupted sleep. Your brain, heart, and entire body will thank you. We're not done yet. Now that you know what not to do, follow me along, because in the third and final section of this video, I'll tell you exactly what to do the morning of your test to keep your health safe, get accurate results, and get back on your feet quickly. Watch on. Mistake for 9. Driving right after your blood test. You've completed the test. Your sleeve rolled down, you're ready to exit, perhaps even drive yourself home. But wait, don't go off just yet, especially if you haven't had anything to eat. Driving after a fasting blood test might be a whole lot more perilous than it appears to be, especially in people over 60. Here's why. You've just missed the mark by 10 to 12 hours on food. Your blood sugar is low. Throw in the stress of the testing, potential dehydration, and possibly a fitful night's sleep, and your body is compromised. Now picture yourself driving. A sudden drop in blood sugar could trigger dizziness, blurred vision, delayed reaction times, or even fainting. That's not only a danger to you, but to others on the road. A case series published in the American Journal of Emergency Medicine reported multiple incidents where older adults fainted or became disoriented within 30 minutes of leaving a clinic, most while driving alone. The common link? Fasting and skipping post-test recovery. So what's the safer plan? Bring a tiny snack with you, something with protein and complex carbs, and consume it immediately after your test. Rest at the clinic for 10 to 15 minutes if you're even remotely feeling out of sorts. And if you can, have someone drive you home. Mistake number 10, ignoring post-test symptoms. Now let's discuss something that many people overlook. You've taken your test, eaten your snack, you're home, and then, out of the blue, you feel a little funny. Perhaps dizzily so. Perhaps a little nauseated. Or just strangely fatigued. You may be thinking, probably nothing. I'll just go lie down and rest. But here's the thing. Those little symptoms could be your body flagging a red one. In people over 60, even mild dehydration or a dip in blood sugar can initiate a cascade reaction in the nervous system. Occasionally, that results in a TIA, transient ischemic attack, or mini-stroke. A TIA is a brief disruption in brain blood flow, usually lasting only minutes. No speech slurring. No drooping face. No pain in the chest, only a little unsteadiness or vague discomfort. And because it's subtle, it's tempting to dismiss. But a 2022 study published in the Stroke Journal found that almost 15% of older adults who had complained of dizziness or nausea following fasting blood work were subsequently diagnosed with evidence of small brain ischemia, small strokes that frequently aren't detected. So here's the rule. If you experience dizziness, faintness, nausea, lightheadedness, or weakness after a blood draw, don't dismiss it. Sit down, drink some water, tell someone, and if the symptom doesn't disappear right away or worsens, call your doctor right away. So let's summarize it all. A blood test may be commonplace,